So, well, good evening.
Good evening. Hello.
Hello. Yes, my name is Naydu Gonzalez, and the way that you pronounce the name is like if you want to say it, I do, you just put an N before, and it's Naydu. Thank you. I am here because of God, so I had to say thank you, God, for the opportunity to allow me to be here. And His purpose is perfect. So He used as an instrument. So He used Nancy for me to be here, which is the connection. And thank you all for allowing me to having me here. I am originally from Venezuela. Had 22 years here in the United States. I have a family husband who is also from Venezuela. He's a physicist. He's a wonderful man, son, friend, husband, father, but most important, he's a godly man. And he has been giving me all the support all the time. I had two little ones. It's 11-year-old Anna and 8-year-old Sarah. I brought some pictures then of us. Last year we went to a trip that was in Mexico. And it's a kind of celebration because God is good. I am a survivor of cancer, breast cancer. So God brought me here with a testimonial. Yes, I am occupational and massage therapist. And that's what I'm going to talk about, how I did survive cancer. And some of you talk about organic and natural, and that's how it is, God. And November 2017, I was diagnosed with breast cancer. It was a ductus carcinoma. It was very localized in my right breast, and it was stage 0. Of course, the news for me was like pouring cold water over me. But immediately I was reading a book that my pastor, we belong to church, and had to say something. I have John Wright with me. John Wright is a brother in the Lord. And brother in the Lord. And he is my business advisor. And we are taking every opportunity possible then. So he's recording me talking to you because this is going to help more people. That is our intention, how to spread the word and how we can help more people, nothing else. So I invite him today because he is my boss, God. And then he told me then, and I told him, and he's here with me. So we are a team, and we all are body of Christ. Yes. Okay, and we are unique, and you all have different stories, and we all have going to challenges, and we are all overcomers. Yes. Okay, no matter what. So I was survivor. That news said, well, you're gonna go. My gynecologist is the one who gave me the information, and then I went to the doctor. So the doctor, the surgeon, because she said you're gonna have a lumpectomy because it's localized. So my story is like while I was listening all the doctors that day, my husband was beside me. Inside of me was like, this is not the road for me. This is not the road, because all the, what is wisdom? Wisdom is when we apply knowledge, okay? So I already knew so many miracles on the tables. And through all of these 20 years or more as a myofascial release and chronic sacral therapy, because that's what I am. That's what I do. So all those news, and I would say, no, this is not my road. I'm not going to go to that surgery. I'm not going to do radiation. I don't need that. It's very important to know what is it, what I need to do, just to have that knowledge, but not necessarily that it applies for everyone. And I was able to give this testimonial in front of an audience, probably 100 people, all therapists, and I say with all the respect, because there is one doctor who's working as a myofascial release therapist, and I say with all my respect that sometimes it's like immediately they're thinking about surgery. Immediately, in my case, they were talking about that probably if they found something else, they will take my breast, and then they will take the other one, and then they do reconstruction, and then if I don't do the entire, take it all, then I had to do radiation. So my husband is physicist, and it's like, doesn't radiation take there all the bad stuff, but some of the good one then? So I prayed about it. Okay, I needed to go to Venezuela to see my mom. So I asked the doctor, I need to go to Venezuela. If you do the surgery, I cannot, and I already had the ticket. And I said, I need to see my mother. So she said, no, it takes the incubation takes a year. So I recommend put me like, I have time to think about it, how I'm gonna do this. So I went to Venezuela. It was part of my healing. I have the opportunity to go to the ocean, to have food, even though it's the situation, and even today is worse, having the food from the tree to the plate, from the ocean to the plate. So all organic, all natural, water, and I combine a lot of first the faith, prayer and support, and then natural, and then therapy, myofascial release. I called immediately the therapists that I know, and 3 of them, we are ready before knowing we were going to get together to exchange body work. And the day I did with them, I get together and I pray for all of them. And then before they put their hands on me, I bring God to this and I say, let me pray for your hands. So I did. And my biopsy was a Thursday. Saturday was the therapy, and Monday I was going thermography because I needed to have something based if I was going into a natural way. Friday I had talked to the doctor, so Thursday, Friday, Saturday, Monday. By Monday, the doctor and the thermography says, okay, no, you're gonna show a lot of inflammation because you just have the biopsy. And it's like, Dr. Ship, I had to have it because I'm leaving to Venezuela, I'm gonna do it. So we did. And before that, put my hands in front of the camera to take the picture. And I said, Jesus, put your hands on me because I'm going to this road naturally. And the picture was taken, and I thought I broke the camera because when I came, remember I had the therapy, 3 therapists working on me, holistic, all the body. When I came, I saw, and I was expecting to have inflammation, redness, and all that, and I thought I broke it because it was all blue, and blue means nothing. Blue means that in comparison with the other one, it was the same. So the lady said, are you sure that you pointed where your biopsy was? And it's like, yes, but I'm sure that I prayed to. So she looked at me, what? And the doctor who do this, he was a pastor then too. And so he was like, this is an amazing testimonial. What did you do? And it's like, I did faith and myofascial release. And I started to feel the healing. That's what I wanted, to have something and then compare it because, it's system. So that's what I do. And I continue treatments once every week for a couple of months until the follow-up. The doctor was, when she called me then to do the surgery, and I said, I'm going to hold on the surgery. I'm not saying no. She was very like, what are you going to do? This is your life. You're going to go against medical advice. I'm not. I'm going to do the mammography as you wanted, but I want to hold them. You said it's a year, so I'm just going to wait. So at the point that today the doctors are scratching their head, and they say, what did you do? Because you have nothing. And they do an ultrasound, and I survive. And I survive because God wanted me to have the testimonial. As I said, we are unique. Not necessarily is like, I'm not saying do not go for surgery, but I'm saying that surgery in many cases is the last resource, okay? I'm not saying don't go because of other treatments, because when it's necessary, it's necessary. You have to hear your body. You have to hear from our Creator. And in my case, that works. And I have another case as a client who has breast cancer, breast cancer, the same like me, a year before me, or 2 years before me. And then she was removed all that. She has the 0 level. They took both of them. And she came to me not because of that. She came to me because she has lower back pain. And the treatment is holistic. You're going to see it. And actually, I'm going to ask for a volunteer to come up here. I think that, Bonnie, you say that you wanted to be my volunteer. So I'm going to ask you in a moment then to come here. While I'm treating, I'm going to tell you what it's about.
Can you tell them what myofascial is?
I'm going to go. That's the next one. So I'm going to start telling what is myofascial. It's based on Psalm 139. That it says, in some of the versions, we have been knit in the womb of our mother. So we literally, we are a net. We are made of a net. That's our creator. So it goes through dimensionally into your body, okay, from the head to the tip of the toes without interruption, okay? And that's what I treat, the fascia system. That's called fascia system, okay? There was a doctor at the beginning of the last year who said that he discovered an organ. I respect the doctor and the research, but the organs, he said that it was the fascia system. Fascia system has been developed the treatments in about 40, 50 years ago. I have been doing this for over 20 years or more, okay? Because it released my pain that I had for 10 years with lower back pain, okay? So that's the fascia. Myo is muscle, fascia is connective tissue. Release is the release of that restriction of that fascia. How? Through advanced manual therapy techniques. This is a specialization, and that's what it gives me a career under my career, okay? So the fascia system is like go through dimensionally, and it's like a hollow tube then. It goes around the muscles, through the muscles, around the muscle, nerves, tendons, ligaments, and through, and it goes to the blood vessels, go to the bone, around the bone, through the bone, go to the cellular level, around the cellular level, and through. So again, we're made of that. When we have a trauma, when we have surgery, any kind of trauma and any kind of surgery, the fascia system, and there is another doctor in France who demonstrate how the fascia suffers when we are caught. Because immediately that integrity model that is perfect and beautiful, and then it's a lot of physics is involved on this. It go through because it's a hollow tube. Then that the energy and the fluidity go through that, and a central nervous system is fascia system. When it's cut and do the surgery, once it is reestablished, immediately the skin and everything is getting together, and it's like a glue, and that's what we have is scar tissue. So yes, I do treat that. So when the people start to experience it, the release of the scar tissue is open up, and it's like coming back to the natural state. If we don't treat properly the fascia system, I'm a massage therapist too, but if we don't treat the fascia system properly, then this is what's happening. But if we treat it properly, this is what's happening. Life, and it's a fluidity inside. That is exactly what happened. It is just a little representation of how that works, okay? It can be the muscle, but through that hollow tube, then energy, fluidity is going through. If I'm talking too fast, let me know. Remember my accent from Venezuela? So at the end, you can ask more questions or clarify. I'm here to help, okay? Because I care about it, and I'm here for you. So I'm going to call Bonnie.
Before I can ask the question, what does radiation do? How does radiation treatments play into what you were just talking about? Because I have so much residual scarring from.
And that is a good question. So what happened is that, well, it's a good question in regards elasticity, okay? Because the fascia system is a component that is elastic, okay? It's like a net. Remember, it's a net. But if it gets so tight, you're going to lose some restriction. If you have scar tissue, then you lose some restriction. So range of motion is not going to be able then too. So you need to gain range of motion. So the treatments is like a sustained pressure in the body, and then you're going to recover the range of motion without forcing it. Because these techniques are not forceful. I'm not a traditional in rehabilitation. It's different. Traditional, not to talk about then everything works. But these actually facilitate physical therapists, these facilitate chiropractors, and we work in conjunction. These really work. But first, not because I'm doing it, but because it's true. First, myofascial release. You try that. Another thing that it helps with pain. Radiation, it kills the bad cells, but also could kill the good stuff. And my husband explaining to me, this is close to where? To the heart tissue. And this is close to where? Respiratory diaphragm and lungs. So it's vital. This is vital. So it was a no for me. It's like, no, I'm not in advance. I'm not advanced. Thanks God, I'm not advanced. It's a challenge then, and that will be the challenge. Even though if I had to go through what you're going through, then I will do my fascial release. Because some of the therapies, yes, has been cancer. They do my fascial release. They do everything then, and God is the owner of a life. He gave our life. He take it away. But it's also true then that we have to go through several trials, right? And he endures. That he's the owner. But we had to do our part. And we're talking organic, and we're talking naturally then. And it doesn't work only on itself then. You need to combine it with nutrition. We're talking about DNA. We're talking about hair. Hair is DNA. And DNA, it's a codification. Okay, it's like having so many words and letters, and you create words of it. Same thing is the DNA. Okay, we are in charge to codify our DNA. How I know it? Because I am a good friend of a chemist, engineer. He's a chemist. He's married with a doctor, and he wrote a book. Then I read his books, and then I learned that. Then we codify it. How we codify it? It's chemist. Cancer survive when we eat a lot of sugar. We want to kill the cancer, yes. So we have to do all what is possible then. So yeah, in my own treatments, then I eliminated sugar. Beside the cancer, I also have thyroid issues at the same time. I have nodules.
Thyroid.
Mm-hmm. That disappear. How they disappear? Not because of the medicine, because actually I didn't take it as should be, because my body was kind of like, no, just natural, just food. I search, I read books, I can share with you. The books that I read, I help me, okay? But the most, I help in here. Why? Remember, if we don't take off that, and then it crushed because of the gravity and pressure and emotional and all of that you talk about, and it's really tight, then it's gonna tight what? Your cells. So your cells are not gonna be capable then to survive. So what myofascial release therapy does? Open up. And what is going through? Fluidity. And that fluidity is life. And that's how many people can help alleviate the pain. Muscular spasms, pain. It alleviated. I'm not saying that I'm curing, but I'm saying that I'm preventing surgery. And even if you need to go to surgery, then I help with the scar tissue. So this lady who came with me for lower back pain, she didn't mention about scar tissue. I found it because it's a whole body response. So I start to treat, I told her, let me treat you, under the breast, the scar tissue then. And she said she was going for surgery because he was in a lot of pain after the surgery and reconstruction. And she called, and after 2-3 treatments, she called the doctor and said, I'm gonna hold the surgery because 50% of the pain has been disappeared with the treatments. So how that is powerful it is, okay? So you wanna come up then?
Does anybody else want to do it? I don't want to. Somebody else wants to. No? Okay. If anybody in treatment wants. Yeah. Okay.
All right. So go ahead and take your shoes off. Oh.
Can you talk some about chicken skin? Because I thought, when I first met Naydu, I thought, this is voodoo crazy. I mean, you're probably thinking that, like, you know,
What is this, right?
I'm Mr. Suspectful, and I'm helping her just because I think more people need to know about this. She's helped my wife suffer from fibromyalgia, but she's helped her. She helps colicky babies. I've seen babies that will not stop crying, and she untwists their skin.
It sounds like I'm doing this with him.
But it's like they're in a pretzel, and then she fixes them, and they stop crying.
Can you
And
tighten it?
I'm like, I've been a young parent, that's like a miracle. But I just want to say that if she can explain the chicken skin, that helped me to get it in my brain.
Yes,
Sorry
thank
to
you,
interrupt
John.
But I want you to help them understand.
Absolutely, yes. This not only treat trauma, but we're all going through a trauma every day, you know. But yes, the baby, it sounds like I'm raping the baby, but it's not. It's a very gentle treatment. I'm very connected. Remember, we're kind of a physical level, because so this is related with. So he's my boss, so I can feel, I getting into the feel of what's going on. And then I'm a mother, so I can hear why the baby's crying. So one of the babies came with me with colic, and he had colic. But when I see it, it's like this baby's in pain, okay? And I say to the mother, how was the delivery? And how was the pregnancy? So well, the baby was stuck on the right hip all the time, and the delivery was very traumatic. It's like, your baby has neck issues and he's crying because of that, and he's not eating from the breast because he's in pain. And besides, you need to be treated too. So I was treating the baby. I don't, some therapists treat for 45 minutes. I treat until the baby's released at there, and I feel like, and the baby release, and you can see the eyes. It's like, I can move my neck. That's what he was saying then. But we go to different stages with the baby. We are all unique. And then I have 100% so far with the babies successful, okay? So, and then after that, I treat the colic, okay? I treat also lip tied with the baby. So I treat babies. I do pediatrics, geriatrics, all ages, runners, athletics, and I do fibromyalgia. Years ago, I was diagnosed with fibromyalgia also. And then I say, no, I'll take a label on me. I'm going to do what I have to do. Again, I like to eat and to sugar then too. So I had to do my own homework and get treated. And it helps me to get results. So that's what I'm doing, okay? So usually what I do, it's a scanning of I do a postural evaluation in my treatments. Okay, you come and then you change, and I do the landmarks, and I can see if it's one shoulder higher than the other, the hips, the knees. So I just standing, and then I do that evaluation. But for purpose of here and demonstration, I'm going to ask you to lie on your back, head over here. So myofascial release, it's a very gentle technique. I'm going to put your shoes over here, okay? It's a gentle technique. It's not going to force anything. Everybody is unique, okay? But it's gentle and sustained pressure in the body. So yeah, and I combined my expertise as an occupational therapist and rehabilitation, and I can feel where the tension is, the range of motion. I do a lot of scanning with my hands. And in other words, I hear God gave me that in my hands, that gift to listen to the body with my hands, okay? So I quiet my left brain, and I use my right one, which is the artistic, the feeling, proprioception, and we all have that. So this is very important then for you, just kind of like breathing into your nose and exhale through your mouth. Feel the tension in your body. Don't fight it. Just be with the tension and give permission to your body to soften, to let go, and to trust. Okay? And no, because Bobby, right?
Bonnie.
Bonnie told me that she's a survivor of the breast cancer. But yes, definitely I feel a lot of restriction into the chest area, okay? In the past, the people were thinking it's like, it would be okay to treat myofascial release and cancer. Before it was very only for breast cancer and depending on the pressure. Today, all cancer patients can be treated with myofascial release.
Can you have that if you've had spinal surgery and have plates?
Can you
in
move
the-
down a little bit more down? Say it again, I'm sorry.
Can you have that if you've had spinal surgery and have plates and rods?
Yes. It's very gentle. Then another specialization that I have, it's called craniosacral. I think I mentioned at the beginning. So craniosacral works with the central nervous system and by extension with the rest of the body. And what is the body? Is all made of fascia system. So central nervous system is fascia system, nerves is fascia system. Everything is fascia system. So everybody is unique. So with people who have surgeries and rods and fusions, then yes, it will help them then to release the pain. They gain a little bit of a range of motion, but the freedom for any other restriction and prevents further restriction. Okay.
Can I say too, back to the chicken skin thing? Have you ever had a chicken with the skin on, and then if you lift up the skin, you see the little gray matter between the skin and the meat? That's the fascia. When she explained that to me, I go, oh, it's like a connective tissue.
Plantar fasciitis in your feet.
Yes.
The stuff, and it's like you're all out of whack when your rubber bands in your body are all out of whack. Does that make sense? And so when she explained that to me, I suddenly got it. When she said the chicken skin, I go, oh, okay, that's what I meant by that earlier.
With the chicken skin. Also, it's the fascia system, you're not going to look at in MRI, CT scan, or X-ray. It's going to be in the electronic microscopy. Okay, that's the way I know how the fascia system looks. And yeah, it's that like the chicken skin then, and when you cook that, you open and open and you're going to feel like that is the fascia system. Also, in the window, in a three-dimensional way, a spider web. Have you seen a spider web on the window? Three-dimensional. That's like how the fascia system looks. Okay? So we made of that. And since it's connective tissue, then when you have a trauma or you have a restriction in one side, it's gonna pull you. Okay? I'm gonna put my hand here, right? Is that okay? I'm cold? What's that? You don't want me to?
I'm not gonna take a picture of this.
Oh no, he's not going to.
Deanna, I wish you'd have did this.
It's ironic that this happened, because I asked Charlie when I came in today about, because I had lung surgery, removed my lung a year ago, and I'm still having a lot of pain, and
Mine's 14
Numbness.
years ago and I still have pain.
I was, and then here you are, it's very
Yeah.
ironic that an understanding, and I know, that it has done permanent damage.
They don't, there's no conventional treatment for it. I mean, all lung cancer patients have this problem. If you have the surgery and they spread your ribs, when they spread your ribs, they spread the fascia.
The fascia
you know?
system.
And it rips.
They wouldn't even tell me they broke my rib.
Oh, yeah.
I had to find that out,
A lot of times they'll
6 months
remove the
later,
rib.
it's like,
Yeah.
oh, is that the pain I'm feeling still?
So wouldn't that also apply to someone who's had like open heart surgery and?
Yes.
Kind of
Yeah.
surgery, I would
Same.
imagine.
Same thing.
That's why I
Yeah.
started going to her, because I have this scar from ear to ear from that, resections that I had from the liver and the colon. And when I would exercise, I couldn't do full extension because the scar was like pulling me this direction.
Uh-huh.
I mean,
I had
it
spleen
hurt.
surgery too,
Hurts.
3 months before.
And I'm like, I can't extend, I can't do it. And they kept saying, oh, you've got all this keloids and, that, buildup of the scar tissue. And so I had remembered Naydu before, and well, it's worth a try. So I went, and it's absolutely amazing.
How often do you have to go?
I think I've just been going here lately about once a month.
Mm-hmm.
First you need to go a little more frequently first, but once you get started, it's kind of like you don't really realize you're seeing a benefit until then you don't go, and then it's like, oh.
Yeah, it's really hard to explain to people because she's a little lady and I'm a big guy and I had a shoulder problem and she starts working on my leg and I'm like, lady, you missed it. And I said, no, and she corrected this and then she's like, you're gonna hurt tomorrow. And I'm like, you barely touched me, it felt like a good massage. And then the next day I'm like, oh. So it's kind of sounds like it's out there until when you get the effect, you're like, something's going on here, so,
And I think too, that might help my breathing because of the scar tissue.
Mm-hmm.
And I hemorrhaged, so I had 2 surgeries in one day.
Mm-hmm.
And if I bend over, it's like a spasm.
Mm-hmm.
And I think if they could fix that, couldn't that help the breathing?
Yes, people say that I can breathe better.
Exactly.
I'm walking slowly. Oh, I feel like 2 inches taller. Yes, you are. And I can perform Pilates better because you were telling me that, right? It's like, I was not able to do that and it was amazing. I can do that then. I can close the trunk of my, of my car with more range of motion. It's like, I didn't notice that. I notice it now. Okay, so yeah, it is open up that fascia system that we are talking about. It is gentle, it is safe, it doesn't hurt at all. Are you gonna feel some soreness after? Yes. Yes, you will. Because
Can't be any worse.
but the soreness is for the healing. And you were saying something else and that I don't remember what you were saying. I was gonna.
No, it's just one of the things you gotta try. It's not like you're gonna flex. You said you're not gonna be out much.
You say that, and it's important then.
Oh,
This is not gonna hurt you.
Just doing something like this.
This is not gonna hurt you, and
Just like this.
oh, I'm sorry.
My question is, how is what you're doing in comparison to like what a chiropractor does?
It is a good.
Because I believe in a chiropractor's philosophy as well, as far as I believe that God designed your body to be in perfect alignment, and when your alignment is off, I mean, to me that makes very simple sense. So I'm wondering, how's what you're doing in connection with? Do you like to incorporate your work with chiropractic, or do you prefer what you do over, I guess?
No, you have to listen to your body first. Okay, you are the owner. You are the ones who listen to your body. Your question is important because what chiropractors do, it's adjustment. They adjust the hard part of the fascia system, which is the bone. What I do is, I don't want to give the back to you, but I'm following the treatment. What I do is release the soft tissue. Okay, so you just go to the chiropractor, that's great, the people feel good, but the gravity and the pulling and the force, because it's all physics vectors involved, and it's gonna pull you back again. But if you release the soft tissue, the chiropractor work is gonna be easier and powerful to stay. Okay, so it's up to the chiropractor if he wants to work. It's in conjunction with me then, okay, and you. And then I have one of the chiropractors that I know, one of my clients went there as a usually then, and the chiropractor said, I don't need to adjust you. You're fine. You have to go. I like that chiropractor.
Yeah.
I think it's like 2 different tools in a mechanics tool set. So when you use a wrench where you put a hammer, and you don't put a hammer where you put a wrench. It's 2 different things.
Right. So but it's a natural approach, and with all. I work with also, I'm gonna start then to probably work with a physical therapist. It's a traditional physical therapist, and then finally he understood the importance because we need to release first before strengthening. You cannot strengthening with something is restricted. because it's not allowed you to strengthen it more than you can do. Okay, so there are people who are in competition of lifting weights then, and they may be upset because probably they don't look like a bulky. That has happened. It was one testimonial, and not with me, but he calls that clinic and he said, how come I don't feel like, I look in my mirror and then I don't look like bulky I was, and I get into a competition, I went for release the pain. He started to train and he noticed that he was able to lift more weight than before. Okay, he called back and he said, I'm sorry and thank you. Okay, so we are that fascia system, we are that building, we are that creation of God, and I'm just an instrument in working with the development of this technique for many years. How does it feel?
Good, keep going.
So yeah, you don't have anything to lose, the worst thing can happen is nothing with this. That's how safe it is. A baby, right? It's he doesn't have option. The mother bring it to me, but his smile is a thank you to me, and the tears of the mom release, and I'm able to sleep, and I'm feeling that my baby is so quiet, and they live like, that is a gratitude, and for me, more than anything, I care. I was born for this. I didn't, when I came to the United States, I came to work as an occupational therapist. We moved to Cincinnati. My husband started school in Cincinnati, and I really didn't know what to do. So I hear about this for a professor in Venezuela because I have an injury in my lower back for 10 years. I was hiking, ice climbing, rock climbing, and running, and backpacking. Venezuela is a beautiful country. And I had to have Advil or Tylenol for 10 years every single night. So when I discovered this, in that week that I did all this, the first 3 seminars then, 2-3 days I was gonna take my, my Tylenol or Advil, then out of them, it's like my body says, you don't need it anymore. And since then, I haven't needed it. Just had 2 babies then, and I had to take it after the delivery. But once my body was back, I didn't have to use any more of that pain medication. So, nutrients, it release and open up the fascia system. We're talking about liver, talking about stomach, talking about lungs. Yes, we'll open up. And if you're taking the medication that you need to take, through the fascia system, it's going to be like a shower of that. So it's going to facilitate any process that you're going through. Sometimes it goes emotional then too. Nothing wrong with that. I am not a psychologist, but I have been here many times. So just support that until it goes away. And the body with that trauma doesn't have to deal with that anymore. You release from that and you're becoming stronger. You want to talk more about it, you go to the therapist and talk more about it, yes. But in many cases, you don't even need it. You heal, because this is healing. We're talking about healing. In all perspectives then, but it's healing.
And if you have a smartphone, if you'll pull out your smartphone, her website is nayduvellness.com. So that way there's testimonial videos on there. You'll see people who have suffered with things for 20 years. And I'm certainly not trying to sell it, I just believe it.
Yeah, I'm very interested. I have another question.
Sure.
How long is a traditional treatment, like a session? Is it 30 minutes, 40 minutes? How much time do you spend doing what you do?
Everybody is unique, but it's usually a minimum between 30 an hour. But it's better to use another approaches and programs that I have and I offer, because you take it most of it.
And did I hear you say that what you do is very beneficial for someone that has fibromyalgia?
Yes.
Okay, I have a girlfriend that has tried
Are you
everything.
doing okay?
Yeah,
I would
I'm
like to
very
invite somebody
excited
else on the
for
table.
her
Yes,
to
yes.
try.
So you're gonna roll on your side and then sit in.
It's
Okay.
really helpful.
All right. Would you like to come on the table too?
Oh, sure.
Okay.
You wanna do the
I'm gonna
handouts?
run to the restroom.
Okay, Bonnie,
You wanna do the handouts?
yeah, Bonnie, while I do the hangouts, then could you tell them how was your experience then with the little bit that I gave
It
you
was,
then?
it was gentle, it was relaxing. I'm a big fan of massage therapy anyway, and then being a survivor, going through surgery, 32 rounds of radiation, the residual scarring. I'm 7 years out and I still have the pain. So, I'm coming. I'm sold, because I already buy into this stuff anyway, so. But very gentle, very gentle. And,
Thank you.
you know, the worst thing that people have to get over with something like this is up here.
Yeah.
Because I can't get my husband to go get a massage, because
Yeah.
he just thinks, no, I can't do that. It is the most wonderful thing ever to go
You know,
get.
this is more than a massage. I've
It
had
is, but I'm
massages.
saying you gotta start somewhere, and if you can't even go get a massage, you know,
Right,
you're
exactly,
probably not
good
gonna
point.
come to this.
Massage therapy. I'm a massage therapist, so that is a good point. Thank you so much, Bonnie.
welcome.
Thank you.
Thank you.
And
Now that you felt me up.
so massage therapy. Thank you.